Dear friends, today I am coming in a very common. Low sex desire in wife could be from the first day of marriage, or in some cases, it is during the courtship period, it is evident, or it can come later on, anytime in the married life. The reasons are two, either psychological cause or there can be a pathological cause. Whatever the cause, it needs treatment and it is well treatable. Child molestation. You must have heard of this word, child molestation. Our governments are framing tougher laws for child molestation. As because this is one of the major reasons, psychological reason why a woman cannot enjoy sex throughout her life. So child molestation is a very big issue in our country. Then the second psychological pressure is, kind of an upbringing and social pressures. Society wants to get married at particular age where the woman is not ready for marriage, not ready for love, not ready for intercourse. Such things you can see in the rural India where the woman registers sex. Then comes the infighting between the couple. Infighting between the couples leads to depression in women, especially if the woman finds out some kind of an extramarital affair of the husband. If the husband is flirts with other women too much, if whatever the reasons of infighting, miscommunication, the desire gets affected. Yes, after marriage, a woman can develop an inverted uterus anytime after pregnancy, before pregnancy. Then she can develop endometriosis, which is a very common cause of loss of sex desire and pain during sex. Then comes vaginal discharges. During vaginal discharges, there can be a pain or there can be no sensation at all for women, and they will lose the interest in sex desire. If there is a lack of foreplay and tenderness from the side of husband, again she can lose the sex desire, sex lubrication, and due to dry vagina she can lose the sex desire. So these are the normal pathological things, and pain during sex is never psychological. It has to be some kind of a disease related. So once she gets a pathological desire, she needs all the more consultation with both a gynecologist and a psychologist together. Treatment, you know, if there are psychological reasons, as we said, there is a history of child molestation, then she will need a long counseling. She has to explain that whatever had happened was a crime by the other person and nothing of your fault. If she has a thing that sex is bad or dirty and she wants to avoid that, then she needs a clarification of these doubts. If she feels that it is her only duty to perform or give her body to the husband, then again she has to be told that sex is to be enjoyed and not to be performed as a duty. So these are the basic psychological reasons. And if there is a pathological reasons like white discharge, which is very common, it is treatable by medicine. And sometimes chronic vaginitis needs some kind of a operation. Endometriosis can also be tackled with the medicines. Ovarian cysts are the another cause of pain during sex. They needs to be investigated and dealt accordingly, either with medicines or with some laparoscopic procedures. But overall, be aware that the woman sex problem, commonly women suffers from very low sex desire, and this is a treatable condition. Thank you so much.